Protect Me, You, Us, a shared clinical decision-making approach for adult COVID-19 vaccine conversations. This video is brought to you by the Behavioral Health and Wellness Program at the University of Colorado Anschutz Medical Campus, with support from the Colorado Department of Public Health and Environment. Healthcare providers remain the most trusted source for information about vaccinations, and there are low-burden strategies to effectively talk with patients about any uncertainty or concerns they may have. In this video, we suggest specific strategies and language that you can use to address mistrust of and concerns regarding COVID-19 vaccines. There is a three-step evidence-based process to maximize vaccine acceptance. 1. Assess disposition. 2. Use motivational interviewing, or MI, to talk it out. 3. Make a plan. These steps, built upon shared clinical decision-making and motivational interviewing skills and strategies, will assist you to increase patients' motivation for change. Past research has found that even vaccine-hesitant participants remain open to learning about vaccines. When treated in a respectful and affirming manner, the majority of patients express a genuine desire to have an open and honest conversation with medical experts. Many vaccine-hesitant patients will eventually decide to be vaccinated, but this is often based on a decision-making process rather than a one-time conversation. Through effective conversations, you can start patients on their personal path to health. In this video, you'll see some common conversations about the COVID-19 vaccine, featuring healthcare visits with patients who are vaccine hesitant, to demonstrate how to move through the 3 steps to vaccine acceptance. Now let's start with step 1, assess patient disposition. With COVID-19 vaccination conversations, you'll want to start from a shared clinical decision-making approach and offer a vaccine recommendation. The recommendation and any information you provide should be offered in a collaborative way. You want to communicate acceptance, curiosity, and autonomy support. Likely, your conversation will start with a question, such as, "Did you get your COVID-19 vaccine yet?" If the patient's answer is no, you'll want to follow up with something like, "What are your thoughts about getting it?" Based on your patient's response, you can assess their disposition. There are 4 vaccine dispositions to consider. 1, a person can be accepting. This individual is open to getting the vaccine, so no additional conversation is needed. 2, there's the cautious acceptor. A patient may have questions about the vaccine or need more information to confirm they want to take the vaccine. 3, they can be hesitant. With someone who's hesitant, you'll want to engage in a dialogue about their concerns, align their priorities and values with getting vaccinated, and evoke their motivation to accept a vaccination. 4, there's the refuser. With a patient who is firm in their stance against taking the COVID-19 vaccine, your priority is to invite an ongoing dialogue about vaccination. Now let's meet some patients, Teresa, Cal, and Aaron, as they talk with their provider, Dr. Kelly, who asks them about their interest in getting the COVID-19 vaccine.
Hello, Teresa. Thanks for coming in.
Well, thanks for seeing me.
So your thyroid tests are back, and I think we may have an answer as to why you've been so tired lately. I'd like to review your results and go over your options, but first I wanted to check in on the COVID-19 vaccine. Have you gotten vaccinated yet?
Well, I haven't had a chance to even think about it. It's been so busy. It's so stressful for me now.
You've been so busy and so stressed you haven't had time to even think about it.
That's right. It's been hard enough for me to get here today. I had to take 2 buses, and I was just about to miss the second one. I almost didn't make it.
It took a lot of effort for you to make it to our appointment today. I know it's not easy to get here by bus. You're obviously committed to your health, and I really appreciate your effort.
Yes, I'm on the buses all the time, and it's very exhausting, but I don't have any other choice.
Well, I certainly understand. Well, since you haven't had time to think about it on your own, would it be okay with you if we take a few minutes right now to talk about the COVID-19 vaccine?
Oh, sure. Yeah.
What are your thoughts about getting the vaccine?
Doctor, if you could give it to me today, I'd take it. I really worry about getting the COVID-19 and bring it to my family. But I'm out there all the time taking buses, cleaning rooms at the hotel, going to the grocery store, everything. I wear 2 masks. I wash my hands all the time. They're so dry. But I worry at night that I'm going to get sick, bring the virus to my family.
Now that we've heard from Teresa, what do you think is her disposition? Is she an acceptor, cautious acceptor, hesitant, or a refuser? Take a moment to consider your assessment. She's a cautious acceptor because she doesn't have any internal conflict about getting the vaccine. Her concerns are logistical. Before Dr. Kelly engaged in this conversation with her, she may have looked like she was hesitant. She says she hasn't thought about the vaccine, and her presentation of being stressed and irritated could be taken in error as a sign of being hesitant or a refuser. Now let's meet Cal.
Hello, Mr. Wilson.
Please, call me Cal.
Nice to see you today, Cal. I know you're here to talk about your blood pressure, but before we get into that, I'd like to ask, have you gotten your COVID-19 vaccine yet?
No, not yet.
Well, because you have 2 chronic health conditions, AFib and hypertension, you're at a greater risk of developing a severe case of COVID-19. Additionally, African Americans carry a higher risk of having a severe case of COVID-19. What are your thoughts about getting vaccinated?
To be honest, I'm not sure that I'm ready to take the vaccine now. I may want to wait a while and see how things play out. Who knows if the vaccine is even safe?
So you want to see how others do on the vaccine before you take it. You're not quite ready yet.
Yes, I don't think so.
What do you think about Cal's disposition? Is he an acceptor, cautious acceptor, hesitant, or a refuser? Consider your assessment. He's hesitant. We hear very clearly from him that he's been thinking about the vaccine and has some concerns about vaccine safety. Let's see what's going on for Aaron.
Hello, Aaron. It's good to see you again. How are you doing?
Oh, it's all right. Yeah, I'm okay. Yeah, all things considered.
So I know you're here to talk about your asthma and to refill your prescriptions. But before we get into that, I just wanted to find out about the COVID-19 vaccine. I know during your last visit, you said you did not plan on getting vaccinated. What are your thoughts now that the vaccine is available?
I don't know. I still haven't made an appointment yet.
Sounds like you're thinking about it.
Look, I don't think I need it, all right? But my girlfriend wants me to get it, so.
What's Aaron's disposition? Is he an acceptor, cautious acceptor, hesitant, or a refuser? He's hesitant. We see from their conversation that he was a refuser in their previous visit. However, we can tell from what he's saying that he could be open to considering it. We definitely want the opportunity to hear more. In this video, we demonstrated a simple 3-step process for patients who are COVID-19 vaccine hesitant. 1. Assess disposition. 2. Use MI to increase motivation. And 3. Make a plan. For more information or to arrange for additional training in motivational interviewing and COVID-19 vaccine hesitancy, visit our website www.bhwellness.org.